So one of the techniques I'll show you first. Yeah, so make sure on the belly. Yeah, maybe a little bit different. That's fine. Make sure a bit higher. So only on the tummy, not on your pelvis. So the pelvis drops down. So kind of what you want to do. Yeah. So let's say the patient's got compression on the left side. Okay. Let's say he's got compression of L3 nerve root. So what we're gonna do also, you can put a couple of pillows, also put this leg away, you know, and maybe even pull the pelvis across so it's more opening on that side. Okay. Then I use my sort of in between hypophyna and phena eminence, and I'm going to contact spinous process. So even though the problem is on this side, I get a better grip through the spinous process than on the transverse because we've got still muscle, quite a bit of muscle there. Okay, so sort of phena, hypophyna eminence around this area. So what I need to do, so let's say if I'm right-handed, yeah, I use my left hand to pull the pelvis down even more and sustain that. Okay, and then I move the spinous process of, let's say, L2 in that carefully direction. Can you see that? So this force is down, so more opening, this force is up. So then I'm not, you guys, if you do this, that's skin. So make sure you get the skin slack first and then you mobilize. So through the spinous process towards carefully direction. Now if I don't block enough here, everything is moving. Can you see that? So it's really about holding, blocking that, and then applying that mobilization. So it's almost like modified Maitland, if you like, but in a carefully direction, no compression, but more towards the head. So pressure is going that way. Okay. So block and push up that way. 45 seconds, around 3 sets of that. Okay. So that could be one treatment. So as the patient get better, or maybe this is, patient doesn't like that position that much, I get you come in 4-point kneeling for me, please. Here. And almost the feet are off the bed. And now drop your bottom towards your heels. Good. And now your hands could be a bit more to the side. And you can relax this way. So guys, again, that's a nice lumbar flexion, isn't it, position? So maybe just come a bit higher on the bed so I don't want you to fall. Yeah, perfect. So from this one, again, what I do, I block, if I'm right-handed, I block with my left sacrum and pelvis, so pushing it down a bit. And from here, I can mobilize him in a bit of a flexion as well. Okay, I don't think so you got that in your nose, but just before to show you as well. So that could be a nice flexion mobilization as well. Remember, we also, what we did with the belt, that kind of almost self-traction a little bit, yeah, that small mobilization. Maybe later, not in that acute setting. But this, the patient should feel more comfortable. People with spinal stenosis, they like that. It's more flexion. Extension usually is more provocative for a patient. So block that and find the spinous process that was a problem, and then you just glide into that careful direction. Okay, again 45 seconds, around 3 sets of that on day 1. Okay, so do I have anything else? Can I just quickly have a look at your book? I want to show you too much, so for compression this. Yeah, so home exercise, what would be the home exercise, guys, we can do to improve that flexion? So that one of them with the belt would be, but another one is patient supine. Now hugging their knees, both knees, and then you can just roll towards and a bit of let go. So that's more general, but that also creates lumbar flexion, isn't it?
Yes.
And we saw that from the biomechanics, what happens, yeah, in terms of the vertebral foramina. Yeah, so we can do that again. How many repetitions? We kind of like to say 3 sets 20. Why 3 sets 20? I don't know, everybody says that. But I think it's all about your clinical assessment and your judgment. So if a patient can do it comfortably 10 times, but then by the 15th time they started to flare up a little bit, that means 10 is a starting point for this patient. And we do that maybe 2 or 3 sets of 10. And if there is no flare-up next day, keep him at 10, couple of sets. Next week, increase by 10%. And then you always that's gradual progression. So it's no that boom and bust. So just, because no one really can say how many reps. It really depends on the patient and how they respond to exercise. Again, don't say pain-free. I say if the pain is tolerable, it's not shooting up, and you can manage that perfectly. Because if we say pain-free, and they immediately feel pain, oh God, so you kind of also a bit mindful. It's all about that, education, especially people a bit more sensitive, a bit more hypervigilant, and we've all seen those patients, so we just have to kind of be very gentle with these patients. Just make sure they understand it, and then, another one could be, remember, with a belt, mulligan snag with a belt later on. Again, lumbar flexion. You can do that. As you get even better and better, what we could do physiological rotation technique. Remember that one?
Yep.
So let's say pain is on the left, compression, but I'm talking about in the later stages. So we will put the patient flexion, right side bending, coupled with right rotation. So we position in that way, and then again, if it's, let's say, L3 compression, block L2, and rotate L3, because that movement is now to the coupling. And by the end of it, do not avoid extension. Once you can tolerate, expose him to extension as well. So I always say, look, to have a healthy spine, you need all movements, flexion and extension and side bending. But when we do that, it might take a little while. Any guys questions on that? Okay, so let's try the technique with a pillow. Walking, carefully glide, in 4-point kneeling, locking the sacrum, carefully glide, and then maybe some of the whole exercise.